is this the right setting for somebody to be in if they have that type of medical frailty?
Early release from medically weak prisoners. I'm your state capitol reporter, Alana Johnson. A bill that is on its way to Governor Whitmer's desk will allow prisoners deemed medically frail to seek treatment outside of prisons. So I talked to community leaders about what impacts that may have for our neighborhoods.
This is only going to get worse if it isn't addressed.
Jasmine Wells advocates for prison reform with Safe and Just Michigan.
Medically frail people, by definition, are people who are terminally ill or mentally or physically incapacitated.
She says that due to the increasing number of medically frail inmates due to age, state prisons will need to use more of the general fund to treat and care for weak inmates. Kyle Kaminsky, the spokesperson for Michigan Department of Corrections, says that Senate Bill 599 changes the definition of a medically frail person and the places they can go after being paroled.
The way the definitions work and some of the other challenges with that law, we're only able to actually parole one person under it.
Under the bill, medically frail means that a person is a low threat to society, is not violent, and has at least one of the following: a condition that prevents someone from walking without assistance, a terminal illness that gives them less than a year and a half to live, or a disabling mental disorder that needs nursing home level care. But that doesn't mean just anyone qualifies.
So those serving a life sentence, those serving for criminal sexual conduct in the first degree, they can't even be considered under this law.
There is also an extensive process to reaching the parole, including health evaluations, parole board hearings, and even an appeals process from victims and prosecutors. But another point in the bill raises some concerns for law enforcement.
If the condition for which the person had received parole no longer existed, that person is no longer required to report that information to the parole board.
David Fannis is the deputy director of the Michigan Association of Sheriffs and says the organization does not oppose medically frail parole, but believes transparency is key for public safety.
As I stated, we didn't oppose medically frail parole, and I want to make sure that people understand that. We just wanted to make sure that public safety was taken into account. And if the person, for example, no longer suffered from the ailment which led to the release, then we thought maybe it should be reassessed as far as a public safety perspective would go.
Ultimately, it's about utilizing better resources and lowering the costs for our neighbors.
Medically frail parole promotes better placement options and lower costs for the state of Michigan.
Now Governor Whitmer has the ability to veto the bill when it comes to her desk. In Lansing, Alana Johnson, Fox 47 News.